I want you to move from overwhelmed by information to confident in what really matters. I want to help you move from being unsure towards direction and purpose in your healthcare. I want to introduce you to health experts. I want to let you in on tough conversations on women's health. I want to give you a place where you can lean in and learn how to take care of yourself. Let's transform your health. Let's get clear on your goals. This is Women's Health Unplugged. I'm your host, Dr. Jordan Robertson, naturopathic doctor. We're going to switch gears a little bit today, and we're going to talk about the young menstruators in your life. We're going to talk about teens. We're going to talk about puberty. And I want to give you some confidence in how to navigate this with the people that are in your lives. Certainly they could listen to this episode also, but I'm kind of gearing this conversation towards the moms that might be listening on behalf of their young menstruators or dads. I'm so glad you are at this episode too. We're going to talk about teens. And part of this idea to do this topic, this came from two places actually. And I was sharing this where my ideas come from. The other day I was in the mall with my daughter. We actually had gone in as an entire foursome, and we decided to split up because the stores that she wanted to go to were different than the stores that my son wanted to go to. So we split up, girls and boys. And as we were riding the escalator away from the boys, my daughter turned to me and she said, "I'm so happy that I'm a woman." And I was like, "Oh, that's why, Char. That's amazing. But what made you think of that?" And she was like, "I don't know if they love going in a store as much as I love going in Sephora." She's like, "I don't think they love outfits as much as I love going in and looking at an outfit. Nothing in the mall makes them as happy as those things make me. And I'm so glad that I'm a woman and those are the things I get to do." Now, before you jump all over me, of course, there are wonderful people that work in Sephora who don't identify as women. And she wasn't saying it for those reasons, but what she was noticing was that the two men in our lives were going to look at ball caps, and we were going to look at everything beautiful. And the purpose of us going to look at these things is because we wanted to feel beautiful, look beautiful, have beautiful things around us. It was a very feminine energy kind of shop that we were having. And I thought it was just the coolest thing that she even realized that she has gratitude for the way she gets to feel about those things. And that she identifies those things as being part of her positive womanly experience at 12 years old. It made me smile. And then I also, at the same time, am working on educational content for clinicians and really doing quite a deep dive on early hormone conditions so that they are better educated and better equipped to be able to support you as you work with those clinicians, but also to help create, this is always one of my goals, I literally would like an army of evidence-based women's health clinicians who can stomp out all of the hormone crap that is online. And so I have this vested interest in all of them being quite confident with these conversations so that they can get rid of the apple cider vinegar, your hormones are causing all your problems nonsense that I have to look at all the time online. And so I've built out a training module that we're putting out for our clinicians starts in February, that literally looks at the differential diagnosis of hormonal conditions and whether or not you use lab work, how to use lab work, and how to support patients depending on what bucket they fall in as far as what hormonal condition we think they have. And as I started to build that out, I went right back to the beginning, looking at young menstruators or pre-menstruators and the conditions that can show up in those young people. And I realized that I've never really equipped you with that information, and that understanding what's normal, what's not normal, when to investigate, when to push for investigation is important. And so I wanted to really talk about that first period so that we can have you feel better informed and more calm, cool, collected when the conversations come up, but also for you to be able to navigate healthcare better. I will say, and I didn't work with that many young menstruators often in my practice. Towards the end of seeing patients, I exclusively worked with people in perimenopause and menopause. However, people's early period stories often become really relevant in their later years and decades. And so even just better understanding what your young menstruator is going through will help you help them. If they ever have to step foot in a fertility clinic, if they ever have cycle irregularities in their 30s or 40s, understanding this decade here between like age 10 and 20 is incredibly important for their future menstrual health care. So I think it's important that you understand it and that you can help them then understand it. So the average age of menstruation, that first menstruation, which is called menarche, has decreased a little bit. And on paper, it's a small amount. Technically, it's statistically significant that it has gone down a little bit. There's lots of potential influencers that we have, or influences that perhaps have affected that. You know, our body size is a little bit bigger. Environmentally, there's probably some things that are influencing those sort of like a hormone disruption kind of piece. There's definitely some things at play. And then genetically, there is, some change there with respect to when people get that first period. There's a little bit of a genetic component to it. So if you were a bit early, then your daughter might be a little bit early as well. And then interestingly, like globally, the numbers are a touch different continent to continent. So we do know that there are some influences that are impacting it. Unless someone's really outside of that range, which we've dropped the range a little bit to like capture people that are sort of 8.5 to 9, which is young, all the way up to 15. That first period is going to happen somewhere in that neighborhood, which, much to my daughter's dismay, it's hard to predict exactly when that will happen in that window of time. Now, what I want you to be well equipped with is understanding when we start to deviate outside of that like average age of 12 or so. Is it meaningful or is it inconsequential? So if your daughter is otherwise very healthy and she gets her period at 10 and a half, just because that's a little bit younger than the mean doesn't mean that it's pathological. Now, if that is accompanied by a whole bunch of other symptoms, and we'll talk about what those are, that's where we want to sort of line up a case that we might want to investigate a little sooner. To start, I want to talk about periods that don't come or periods that come late, because that's actually probably the more important to investigate. If your daughter's period has come a touch early, actually, I will stop and talk about that for a second because it's a bit of an easier conversation. If your daughter's period comes a little bit early and it's not accompanied by any other really dominant hormone symptoms. So let's say she has that sort of normal breast development. She has a average secondary sex characteristic development, meaning that she has pubic hair, other changes to body hair like armpit hair, and it's happening. It looks and feels like a regular puberty. It just happens to be at a younger age and maybe younger than you. we're going to call that like within the realm of normal. The pace at which young people develop is also like decently slow. Usually when breast development starts, the period does come within like 12 to 18 months of that. And the breasts do move from those little like kind of like soft pads that you can tell have changed under the surface to a bit more of a formed breast bud. As they start to move into that little sort of pointy breast bud, that's when they're getting closer to having the hormones required to initiate menstruation. So those are the kinds of things you're looking for. And, you know, the progression of those symptoms, again, like I said, is relatively slow. If we have a massive development of secondary sex characteristics, meaning that there is suddenly significant body hair or additional body hair beyond armpit and pubic hair, where there's some facial hair development that is like really out of culture for your daughter, that then we're going to want to investigate, right? If the development is happening quite rapidly, if it's accompanied by more testosterone based symptoms like really significant acne, and again happening relatively rapidly, those are going to be the kinds of symptoms that are starting to fall outside of the norm. So yes, it's normal for teens to have acne during those big somatic growth spurts and hormonal growth spurts, but it's like how rapid those symptoms show up is actually a bit more problematic. And we do want to maybe do some assessment on that. So it's not just do the symptoms come, it's the speed of them coming together that we maybe would want to investigate. Now, if those symptoms have come over the span of like 6 to 12 months, we're going to call that again in that realm of normal and maybe is not needed to investigate. But what's more common if we're looking at concerns around menstruation is the absence of menstruation or significant irregularity when that menstruation does start. So if your young person has made it all the way to 13 and they have no period and they have no secondary sex characteristics, meaning that they have not started any other symptoms associated with puberty, breast development, armpit hair, pubic hair, maybe even some changes in body shape, then we're probably going to want to investigate that. This is one of those times where I actually find it quite difficult to get a physician on board, is if we have a 13-year-old or 13-and-a-half-year-old that has zero evidence of any hormonal initiation to change their body from a puberty perspective. My experience with that has been that most physicians will say, let's just wait longer. Even though technically in the standard of care guidelines, if a person makes it all the way to 13 with no period and no signs of hormonal development, they should begin a hormonal assessment at that time. What's more common is that people may make it to 15 years old with no period, and then we'd certainly want to investigate if there are no other hormonal symptoms that have come up. But if they do have other hormonal experiences, right, they have that secondary sex characteristic development, but no period, then we're going to want to investigate the 15-year-old. So at 13, we should investigate if nothing is happening. At 15, we should investigate if there's no period and or there are other secondary sex characteristics. Now at 15, if there's no period, there's a couple possibilities, and it's not uncommon that we would actually look for an ultrasound in that young person and also some blood work to try and understand their hormonal symptoms. When we do blood work in a young person, we're looking for hormones to be present. It's uncommon that they are perfectly regular hormonal levels in a young person. What we're looking for is sort of the like you can just have a wide range of normal numbers in a young person. What we're looking for is the more extremes, because it teaches us if like where the kink in the chain actually is for why we can't initiate that first menstrual period. The period actually, part of that hormonal cascade actually starts from the brain. And so we check hormones that are in the brain through the blood, as well as checking for estrogen. And that does give us some clues whether or not your brain is or their brains are attempting to initiate that menstruation and are just unsuccessful, or whether their brain actually hasn't started to initiate menstruation at all. And I'm saying this because it's incredibly important that you do have standardized blood work done and don't use another kind of hormonal assessment in your young person. So sometimes you'll see marketed online like urine hormone testing or saliva hormone testing. Neither of those can adequately assess brain-based hormones. And so they're not going to teach you what's going on at the level of the ovary if we don't actually test the brain-based hormones as well. So we use a couple of terms to describe the absence of a period. One of them is primary amenorrhea, and that means that this person we are referencing has never had a period. And then we have something called secondary amenorrhea, meaning that they have had a period and it is now absent. The challenge in our young patients is that technically they can have primary amenorrhea, and the most common causes of that are actually genetic, chromosomal, meaning that perhaps the way that they inherited their X chromosome is has affected their reproductive tract or affected their hormones. The number one condition associated with this is actually called Turner syndrome. There are also other genetic differences in anatomy that may affect someone's ability to menstruate. Occasionally, people are born without some of the anatomical structures that are required for menstruation, and that's why we do imaging on young people who have not had a period, is to assess whether they have the anatomy that is needed in order to have menstruation. So the causes of that primary amenorrhea do need to be investigated, because whatever the cause is that's influencing the ability to initiate that first period actually does require some lifelong support and additional testing and assessment, etc. So if we get all the way to 13, 14, 15 and you find your teen is missing some of those secondary sex characteristics, it is important that it gets assessed, because it will put you down a track of better understanding their overall health if we do that. But the other challenge is that secondary causes of the loss of period can happen in a young person before they've ever had their first period. And this really clouds our understanding and can sometimes mean that we have a big delay in diagnosing young people, because we'll assume that it's fine and normal and within the realm of normal that they haven't had a period. And yet, if we really dove in and if we spent more than 5 minutes talking to you about it, we'd realize that there were other hormonal things or signals that were going on with this young person, and we could actually diagnose the reason why they have not had a period instead of just wading into the abyss to see if it happens. So some examples of that, one of them is polycystic ovarian syndrome, which we've talked about before on the podcast, but it really, that condition, not to oversimplify it, but is driven by changes in insulin resistance as well as in testosterone or high androgens. And young people who have PCOS may miss their first period and then move into a PCOS-like picture and then not get another period, or have incredibly irregular periods, so irregular that we're not seeing it in that, maybe 14th or 15th year, and yet they are struggling with PCOS, not some other cause of the loss of period. So young people with PCOS may have higher levels of androgens and symptoms related to that. So testosterone is that primary androgen, as is DHEA. And young people with PCOS may have more rapid weight gain than we expect compared to their peers. They may have more significant acne than their peers, and they may have an increase in facial hair or other unwanted body hair. So like hair moving outside of the pubic region on like the upper thighs. Again, you have to cross-reference with what's culturally seen. But people who have that more rapid body hair growth and a loss of period and acne, we may find that they actually have PCOS. And again, just waiting for that period to come is actually going to push them like further away from having a successful period rather than getting the support that they need. Diagnosing young people with PCOS can be a little challenging because all young ovaries have that sort of cystic look on ultrasound. And so we don't typically rely on ultrasound in young people because the ovaries can be a bit bulky and have many immature follicles that all look like cysts on ultrasound. But when in young people, we use that history of the like lack of period and then some of the other body changes that you might be noticing in order to try and assess them. And then blood work can help confirm or collaborate with those symptoms. There isn't really one thing that gives us that sort of like stamp of approval saying that someone has PCOS. We have to be quite curious about all areas of their health in order to accurately diagnose them. One of the other causes of secondary period loss, but that can happen in young girls, is called functional hypothalamic amenorrhea. This loss of period actually happens when there is a relative energy deficiency. And so you may have heard this term before called REDS, or relative energy deficit of sport, or this is the kind of loss of period that is associated with disordered eating or anorexia. So when the body doesn't have enough fuel relative to its needs, and that terminology is important. That's why we've moved away from just thinking about the loss of period with respect to eating disorders, is that we can have a relative energy deficit in a young person whose calorie and fuel needs have just started to exceed their intake, right? This happens often in competitive sports. So that relative energy deficit means that the brain doesn't feel that there's enough resources and fuel in order to initiate a menstrual period. Now, for some young people, they may start having a period at 13, and then lose their period if they move into this energy deficit later in life. However, for some young people, especially since our preteens and teens are often the ones that are competing in competitive sport, if their body size is smaller than their peers, if they are competing in a sport where small size is celebrated, like gymnastics, swimming, running, we may be in a scenario where their fueling needs have started to not be met by their diet, and that can actually turn off the menstrual period. Now, this can be quite confusing because sometimes young people who don't have a period also are missing some of those secondary sex characteristics. And so, you may be looking at your teen and saying, are they small or teeny because they haven't had the hormones yet? Or is being small and teeny actually preventing those hormones from taking hold and initiating that first menstrual period? That's where it's going to be a bit tough to tease out. And it's important to have that conversation with someone who can look really closely at your young athlete or your young person's fueling to make sure that they're actually meeting their energy needs. This would be one of the ones that I would say would fly under the radar quite easily for a long time, especially if your teen is really petite and active and has low body fat. We might assume it's just them or just their frame or just who they are, and yet it may be that their energy deficit that is being created by sport or under fueling is actually preventing their brain from initiating menstruation. And that can happen in older women, right? And I often will see in women that are in their 30s and 40s who maybe are dieting and training significantly. If this is in their past, right? If they lost their period due to exercise in their past, they're a little bit more likely for that to happen in their future. But this may be happening in your teen where you see that their bodies are like trying to develop and trying to have some of those hormonal changes, and yet their period is still absent. It can be worthwhile to just evaluate that whole energy regulation in your teen to make sure that we're not missing something. Now, there are other hormonal conditions that will suppress menstruation: hypothyroidism, hyperprolactinemia, which is elevated levels of prolactin, which is actually the lactation hormone, but it can sometimes be produced in for a variety of reasons, but it's one of the tests that really needs to be ruled out if your teen is missing their period. But the ones I would say that we struggle with that diagnosis the most would be PCOS and functional hypothalamic amenorrhea. Both of those young women, if they're missing their periods, need support and treatment to get back on track. But both of those young people could be chalked up as having a typical teenage experience and maybe be overlooked by your doctor really easily, right? You can kind of see why that would happen. Our young PCOS person has rapid growth, rapid weight gain, acne, right? And we could easily look at that and go, no, your hormones are there. You'll get your period soon. But without taking the minute to kind of understand that this actually feels like very excessive hormone symptoms and that perhaps they're missing their period because of those hormones. Whereas on the flip side, our young woman with hypothalamic amenorrhea is missing her period because she's perhaps on the petite side, maybe exercises, or again is then a aesthetic sport, or again I say a sport where a small body is celebrated. And we might also chalk her teenage hormonal experience up to be normal because of her frame or because of her genetics or what have you, when there actually may be more going on, and having that relative energy deficit and not having a period because of that actually has some pretty decent long-term consequences with respect to like bone health and all of that. So we don't want these young hormonal concerns to be ignored for too long. And I would say if you're sitting back and listening to this and you're like, well, now I don't know if my teen's experience is normal. Thanks a lot, Jordan. What I would suggest is, one, if your spidey senses feel like it's not normal what your teen is experiencing, like talk to someone about it. Even if they have their period and their cramps are more than they should be, I want you to talk to someone about it. We have this huge diagnostic delay in young people, right? If a 30-year-old has hormonal symptoms, we diagnose her right away, partly because she's probably in a fertility clinic. Young people, we don't, right? We call a lot of things the normal teenage experience, and that prevents young people from getting access to the care that they need. We do a lot of watchful waiting in this population. And so if you're listening and you are a parent and you're like, no, I've known this all along, my spidey senses say that there's something going on with my young person, I want you to bring it up with your practitioner. And if you don't like the answer you get, then see someone else. I also want to give you permission to just watch things for 6 months. Most of the things that are influencing your young person's menstruation or lack of are not life-threatening. They just need to be dealt with at some point. And so watching and noticing and thinking about the things that we've talked about today can be incredibly valuable for you to be like, no, you know what? I think this is just them, right? They eat lots. They are teeny. I was 14 when I got my period, right? Like you can think about all these things that might help you better understand your teen's experience. But if you, even for a moment, think that there is something going on that needs assessment, I want you to see your doctor. The other thing I want you to be really mindful of is that diagnosing young people with hormonal concerns is an art form. And it also, you need a real legit diagnosis. We can talk about hormone symptoms in older people because we have PMS and we have encroaching on perimenopause. And even if you don't really ever totally understand what's going on with your hormones as an adult, but we think you have PMS, we think you have symptoms that are worse because of your hormones, you know what? Sleep better and don't drink so much alcohol and have some vegetables. And you're probably going to feel a little bit better. And there would be no consequence if we never really nailed down exactly what was wrong with your PMS, right? In young people, the consequence of us not correctly diagnosing them is a much bigger problem, because now they have a lifetime of needing better hormonal function and a lifetime of probably looking at hormonal symptoms. And so if your young person needs support around diagnosis, I want you to reach out and talk to someone and make sure they get blood work done and maybe some imaging. Okay. I hope you enjoyed this episode. I was sparked by my daughter's loving being a woman because we get to go to Sephora, but also it really got me thinking about how grateful I am that I deeply understand her puberty experience. And if her period started to fall outside the realm of normal, I would know right away. And I really want you to have some of that confidence that the things that your teen might be experiencing might be normal, might be within that realm of normal, and that's okay. But if you're noticing that it's being accompanied by the presence or absence of other hormonal symptoms, then it might be worth a conversation with your practitioner to make sure that we accurately assess her. I'll see you next week. I hope you enjoyed that episode of Women's Health Unplugged. My goal is to help you feel more confident about your health. Please remember that what we talked about today in the podcast does not constitute medical advice, nor was a doctor-patient relationship formed. If you have questions about your healthcare or about how today's topic pertains to you, please take it up with your family doctor, your specialist, or someone on your health team.